Hey guys, in this lesson, we will talk about echocardiograms. So an echocardiogram uses sound waves to create a picture of the heart, valves, and blood flow in the heart, like in this picture. The doctor might order an echo if the patient has any heart disease, valve issues, or a CVA, which is a cerebrovascular accident known as a stroke. So let's explore the different types. So the transthoracic echo is the standard echo where the transducer is just placed right over the heart with some gel. The transesophageal echo is where the transducer is actually going to go through the mouth and down the throat into the esophagus. So the benefit of this is for like a severely obese patient or patients with something in their way of their chest, like a pacemaker, so that they can get a closer view of the heart by going in the esophagus. So Doppler echoes are able to show the blood flow, speed, and direction by measuring the pitch of sound waves as they bounce off the blood cells, like in this picture here. So the stress echo is done before and after physical activity to view the effect of stress on the heart. So let's explore what the nurse should expect before the procedure. So when the doctor orders an echo, go ahead and explain the procedure and why they're having it to the patient. Have them empty their bladder, that way you avoid any interruptions during the test. So during the transthoracic or the standard echo, gel is going to be placed on the skin where that transducer goes, right over the heart, right? So during that transesophageal echo, the radiology tech's going to numb the throat, and the nurse or tech will give IV medication to relax the patient before putting that transducer down the esophagus, like in this picture here. So a bubble study is pretty cool, guys. So this is indicated during an echo if the patient's had like a suspected CVA to determine if there's a hole in between in the heart that's causing like blood backflow through the walls, right? So that can cause clotting. So during the bubble study, the nurse or tech is going to shake up the saline with a small amount of air, and it's going to make tiny little bubbles in the saline. So then the nurse is going to inject it into the IV while the tech's controlling the echo machine so that they can see it in the picture. So the bubbles are going to be visible in the picture on the right side of the heart. It should not be visible on the left side, because what's supposed to happen is that blood that has all those little bubbles in it is going to go out into the lungs, and then the lungs pretty much just absorb all that air. So then when that blood goes back into the other side of the heart, it should look completely normal. Now, if you see bubbles on both sides of the heart, that means there's a hole in between, allowing those bubbles to go right on through. And that can causes, the clots, which can lead to CVAs. So guys, this is pretty neat to watch. I got to watch this for the first time. I floated to neuro recently, and they showed me how to do it, and I got to inject the saline. It's pretty fun. So after the echo's order, wipe off any gel from the skin. The radiologist is going to interpret the results, and the doctor will explain it to the patient. So let the patient know that they need to remain NPO if they had that transesophageal one done, because it's going to be numb in their throat. So once that numbness is gone, then they can start working on some fluids and kind of work their way up to regular food to prevent choking. So let's touch on patient education next. So prior to the test, the doctor might order the patient to be NPO, usually the day of the procedure, which means nothing by mouth for a few hours. Let the patient know that they shouldn't eat or drink anything until that numbness is gone, because we don't want them to choke and aspirate on something. All right, guys, so our priority nursing concepts for the patient with an echocardiogram are perfusion, oxygenation, and patient-centered care. Okay, now let's review the key points. So an echocardiogram uses sound waves to view the heart and blood vessels along with the blood flow. The different types are the transthoracic, which is the standard, transesophageal, Doppler, and stress. Before the procedure, explain why the patient's having it. During the TEE, the throat is going to be numbed and the patient will be sedated. And then if a bubble study is done, that's going to be to check for holes in the heart where the nurse pushes that saline with tiny bubbles into the IV during the echo. After the echo's over, the patient might be NPO if a TE was done until that numbness is gone to prevent any aspiration or choking. Okay, guys, that's it on the echocardiogram. Now go out and be your best self today, and as always, happy nursing.